So what are the stats telling us about the situation in Europe and the situation here?
Yeah, so now if you look across Europe, we've kind of started seeing what people are calling a fourth wave of the virus over there. Cases now have been going up in Germany, kind of France are a little bit lower than Germany. They got up obviously in Austria, where we've heard a lot of murmurs about what's going on over there. The Netherlands and the UK has kind of been higher than the rest of Western Europe throughout the last few months after we eased the restrictions around July time. So it could well be that if you look at the UK cases at the moment, they went down a little bit after half term. They start to creep up a little bit at the moment, and it could be just be bouncing along at the moment. Whereas Europe's going up quite dramatically now. If you actually look at the vaccination rates as well, so you take the Netherlands, where they've just introduced some kind of more restrictions and some lockdown measures have come in, kind of light lockdown measures compared to the past. They've got a higher percentage of vaccination rates than the UK, and they've got. If you start then looking at, say, Gibraltar is a good example. Just to look, it's a small country, obviously, it's just off Spain there. But if you look at the data there now, according to their official stats, nearly everybody in Gibraltar has been vaccinated. So, you're talking probably a good test case of 100% of a population that's had 2 doses of a COVID vaccine. And cases are going up there as well. So if you're looking in terms of trying to curb case rises, which is what the main discussion is around at the moment, then I'm not quite sure just the kind of forcing vaccination like they're talking in Austria is going to address that, because you just got to look at the Gibraltar example to see that the similar trend is going up there at the moment as well.
So in Gibraltar, if you're saying, because I mean that's what what we're trying to do is avoid people dying. So if 100% or literally of the population are vaccinated, what's the death rate like from COVID?
So the death rate, they've got relatively low deaths. I mean, obviously you've got to look at it into kind of some comparison with the death rate per kind of 1,000 people, and it's creeping up a little bit as well in Gibraltar. Because we know that vaccination itself doesn't stop all deaths. When you get a rise in cases, you will get a rise in deaths. It depends on the metric that you're measuring as well, because if it's based on how many people have died with a positive test, when there's more people with COVID in society, you tend to see an increase in kind of deaths overall. So I think the important thing with the vaccine is, if you just take, say, some of the UK data, which I've been looking at, is that so the booster vaccine, which has been kind of being rolled out from the older age groups, starting to go down to some of the younger age groups. I think people over 50 can come forward now. And it is showing that when you've had the booster vaccine, we are seeing a reduction in people kind of catching COVID. And we're seeing falls week on week in older people with COVID as well. So you can see the effect of the booster vaccine there. It's not going to stop the spread completely, though. And a really interesting statistic published this week by the ONS actually was people who previously had COVID and have recovered from it. Basically, there's an 80% reduction in them catching COVID again compared to somebody who's never caught COVID. And it's offering a similar protection to people who've actually had 3 doses of the vaccine. So for large parts of the population now who've had COVID in the past, there's a lot of protection for them in the population now.
So with the statistics, people keep going on about, oh, well, now most of the people in hospital are those who are vaccinated, not the unvaccinated. And I'm thinking, well, isn't that because most people have been vaccinated? So obviously you're going to get more people who've had the vaccine in hospital. Is that not how that statistic would run, or have I got something wrong with that?
No, you're spot on there. So you do see that the majority of patients in hospital are vaccinated. So what you kind of then need to do is look at, say, the percentage of the population who are, if you just do it in kind of relative rates. So if you look at the unvaccinated group, and then you compare them to the vaccinated group, the majority of patients in hospital are vaccinated. But then if you look at the risk between the two groups, you are more likely to be admitted to hospital if you're kind of unvaccinated compared to if you are vaccinated. But there are a number of different factors you need to consider in all of this as well. Is that there could be some people who haven't been vaccinated, for example, in the older age groups, because the vaccine is just going to be too dangerous for them, and they would obviously be kind of at a higher risk of being hospitalised anyway. So there's a lot of different factors at play. It's quite clear that obviously the vaccine for the vulnerable groups are helping reduce the number of hospitalizations and deaths. It doesn't stop it completely. And ultimately, I think we're going to just be in a population now where COVID isn't going anywhere. It's going to be with us forever. Everybody ultimately will catch COVID over their lifetime. And it's that kind of natural immunity that we're seeing coming into the stats now that is going to be the game changer for everybody, I think.
Well, let's bring in our senior clinical lecturer at the University of Exeter Medical School and communicable disease control expert, Dr. Bharat Pankhania. Bharat, it's great to see you. I finally get to speak to you on TV. We're always on the radio when we chat. I want to ask you about the whole thing with vaccination, because a lot of people are saying, well, you know, if they've had the disease, are they better off not having the vaccine now because they don't need it really because they've got the antibodies? What would you say to that?
Well, the sure way, the absolute sure way is to be immunized. And we know that if you are immunized, then your immunity is sustained and specific. And therefore, what you want to do is not risk it and say, I will get my immunity by infection. We don't know where that road would lead you to. On the other hand, a safe, effective, protective vaccine will do the job and keep you safe.
Now, I was reading about the COVID gene, and it turns out that I think it's so Africans have a 2% chance of having the gene, and it goes all the way to, I think it's East Asians who have the highest likelihood to have the COVID gene. Do you know about this, and can you sort of elaborate on it?
Yes, so what we're looking at is mutations. Mutations because of the way people evolve over millennia. And some of the people in the Far East and in Africa have got a genetic mutation that then makes them more susceptible to the adverse outcomes of a COVID infection. Having said that, it is not clear cut. In other words, there are many other factors also at play, and to dissect out, was it the genetics, or was it the loading dose that you got? Was it your poverty? Was it your crowded home that you live in, etc.? So it's very, very difficult to say it is exclusively because of your genetics that you became more unwell. But we do know that there is a tentative genetic link as well as other links. And the other links are really, really, really important. Poverty kills, and poverty is the biggest killer for COVID.
And I was going to say, I think it was the Africans were the least likely to have the gene, and it was the East Asians, I think it was, that were the most likely to have it.
Correct.
Yeah.
That is correct, yes.
Yeah.
Yes.
It's very interesting. So what do you make of some of the things that are going on in places like Austria then, where they're insisting that everyone should be vaccinated, and your thoughts on lockdowns as well?
So let's talk about Austria first. And I look at Austria and I think of the United Kingdom in equal measures. And I feel this is a clear example of a populist chancellor who has not taken early actions to suppress infections, has not taken clear actions when he knew that his people were not being fully immunized, younger people, etc. Furthermore, to put the brakes on whilst the case numbers are going up. And then suddenly, when you look at the graph and it's vertical, case numbers shooting up, he has got no choice except to install a shutdown as well as mandatory vaccines. Now, talking about mandatory vaccines, as somebody who is a veteran of immunizing over 30 years, I am not happy about it because I would rather inform, advise, educate, and allow people to make their free choices. We're in the long term here with our patients and our relations with our communities, and to force them against their will goes against my experiences and everything that I believe in.
Interesting. But when you've done all that, what next can you do? Dr. Pankhania, thank you so much for joining us. I'm just going to quickly come back to Jamie for the last word, because I wanted to ask you then, so from your statistics, do lockdowns work?
Well, it's quite clear when you lock the population down, then it stops people mixing in society. So it puts a pause on the spread of the virus. And you can see that every time there's been kind of lockdowns, we have seen things come down. Even with the recent half term across England and Wales, where there was a lot of mixing of school children came to an end, you started then seeing the case coming down and starting going back up. I think the difficulty overall in the longer term is that all it really does is it kind of presses pause on the virus. And then when you reopen society, things start kind of spreading again. So I think that the main goal of a lockdown, which is kind of what we started seeing last spring and when we had the first lockdown, is that if the health system itself is going to become overwhelmed, if you lock down to stop the spread so that people who would need hospital treatment who wouldn't get it otherwise because the whole health system would be overwhelmed, then that's kind of the rationale behind people having lockdowns, I think. And if you look at the cases that go up in Germany, I think they're in a much better place than, say, the UK if we got rising cases, because they got far more beds and ICU beds as well. So I think ultimately, I'm a bit on the fence with the lockdowns, because it's quite clear that as soon as you unlock, cases do go up. But there is some kind of role for something in society when you've got the health system being overwhelmed.
Right, thank you very much, Jamie. Jamie Jenkins, he's an independent statistician. I think I sort of said it right.